I'm very sorry because sometimes it's what I always say. We don't get to always see the patients or the volunteers before they come here. So sometimes they show us some pictures, and sometimes the picture doesn't give us the entire information. In her case, she had a filler in the teardrop about 1.5 years ago, and I can still see there's certainly some effect. So, of course, with her, what we will try to do is to do a little bit of lifting. Si te parece, vamos a intentar levantar un poquito aquí los nasolabial folds, para que no se marquen tanto, and maybe improve a little bit this area here. But she does not need a big filler for the teardrop, because in fact has. ¿Dónde te llenaron? Aquí. ¿Pero dónde? ¿En una clínica?
No, nosotros.
Ah, nosotros, vale. So she still has some filler there. So I will do the mesotherapy to improve the condition of the skin. She does not have a lot of sagginess. Maybe here I will try to do a little bit, but mainly we will try to do a little bit more of this lifting effect, because she does not need a big treatment to the teardrop. Sometimes we show us photos and we don't know if it's a circle, the spot, etc. So in her case, we're not going to do a lot of filler in this area, maybe a little bit here that we can see a little rim, just to improve and to leave the other eye like that. But we will certainly do a little bit of lifting. She has a thick skin, so what I was trying to tell you before, that sometimes with these sorts of skin we need to as well feel a little bit here in the nasolabial folds, because if not, this is very heavy skin and we cannot only lift it with a volume here. Okay. Entonces vamos a poner un poquito aquí para darle soporte a la parte de la ojera, ¿vale? Y para hacer que se marquen menos los surcos nasogenianos, ¿vale? So I'm going to
keluarin dulu aja biar dia nggak susah nyari.
Daripada dimasukin lagi di bagian satu-satu nanti.
Itu pada dimasukin ya. Daripada bagi-bagi aja.
Kita ambil ya. Ini DMA.
Lewat bandaranya lah.
Ini udah ada semua nih di hair
Karitin. Ada.
Udah ada semua ya. Yang dia tadi.
Yang filler intensif ini masih ini dok. Masih trial kitanya masih trial. Karena non lido ya. Di Indonesia kan banyaknya lido ya.
Lido.
Yang intimate yang bagus. Intimate. Jadi yang tadinya nggak adaan jadi pluk gitu. Pernah dicobain.
Jadi mekar lagi dia.
Jadi mumpluk.
Iya. Terus dermamela juga belum kan?
Dermamela udah masuk.
Udah masuk.
Enggak banyak ada apa-apa sih. Benar.
thank you so much. I was going to get the pill.
Iya. Kayak dia besar.
So I'm sorry because the patient for today, the air condition, the AC, if that's okay with you. And we will start with the
Periokular buat mata.
with the periocular. Mira, pues túmbate aquí.
Di sini.
¿Vale?
Katanya tadi ada traneke.
TCA ya.
Kelihatan yang mata ada TCA-nya.
Nggak ada mata.
Periokular.
Belum ada enggak mbak? Belum ada ya mbak Herta?
So she
Dia biasa.
Sudah ada belum Herta?
Sudah lama.
So this is very easy pill.
Iya.
Cierra los ojos. We're going to be placing it just under the eye and all the way to the forehead.
Is
Okay.
it gonna be scale?
Sometimes they can find a little bit of scaling or flaking during the first week, but not very intense, because we're not going to find a lot of frosting unless obviously it's not a patient with very dry skin, which she does not have. Because patients with dry skin, like me for instance, we try to have very little tolerance to glycolic acid. You know, glycolic acid is a very small molecule and it penetrates very quick. And so in some cases we find that it acts very, very quickly, and also some patients it makes the rest of the components penetrate very quick as well. So this one contains salicylic, it contains glycolic, and so sometimes you will find like it's very, but you know, we can place it all around the eye. I'll go to the other eye.
Sampai ke jidat-jidat.
Pica mucho.
Sisa satu wajah.
She says it's a little bit itchy.
No es muy agresivo, ¿verdad?
No, no,
itu ya,
pero
dari
cogí
pember.
el neutralizador para poder poner.
Glycolic acid.
So this is a very easy peel, very safe peel. If you have someone helping you, they can do this before, you know, you're getting ready. If they're waiting you with your other patient and you're in a little bit of, you know, they can start, okay, let me disinfect the area, let me do this peel. She will immediately know like a glow, a stimulation of the dermis. So she would probably, tú tomas mucho el sol, ¿no? Bastante. She has a lot of sunbathing normally, and you can tell by all the sunspots in her hands and her face as well. So
Ya kayak gini, Mbak.
periocular, yeah.
Gede banget.
Kalau di kita masih botolan loh.
Botol kecil-kecil.
Botol yang 30
Setan.
mili ya?
Oh,
Bien.
Sekarang 50.
Sekarang udah 50 udah
Oh, sekarang
ini.
50.
Persis ini.
Iya.
Oh, baru ini
Baru iya.
Un poquito, sí, no
Kalau
mucho.
persis
Gede.
ini ya nggak bocor, tapi nih baru kecil-kecil bocor.
Del 1 al 10
Itu masih
estoy
stok
el
sekarang.
En el 7, okay.
Ini kuat sekali, Mbak. Biar untung, Mbak.
Sekarang per 50 mili berarti udah harus.
So as I say here, you can wait for around 5 minutes. If you feel they are getting already a little bit red, you can stop the peeling as soon as you feel like. So in her case, it's very important to have the neutralizer in hand, because glycolic acid, when it starts to penetrate, it works very, very quick. Okay, and you start to see this really quick reddening. So if it happens that it makes them very uncomfortable, no problem. You put the neutralizer.
Esta me pica bastante.
Yeah, she says this one is,
Sampai sini Kak Dero.
yeah, it's getting very red, it's very itchy. So maybe we will stop more earlier than 5 minutes. Here you can see it's already getting red. And as I said, people with a lot of sun damage, sometimes their skin is very hydrated. Here you don't see because she has like plump skin, but you can feel like she has a lot of little sunspot, epithelites, also hard décolleté on the hand. So probably she sunbathed. Mucha protección solar no te pones, ¿no?
Sí.
Sí. Okay, she says she does wear some protection, but as you know, some protection you need to apply every 2 hours because if not.
Mungkin bisa seluruh badan dan bisa full.
Okay, so we wait. Dime si te pica más porque podremos
di tangan-tangannya.
Ada berapa sih?
Oh, banyak banget.
Dikipasi dah, sakno dah.
No va subiendo el picor.
Neutralizer ya.
Va subiendo. ¿Cuántos minutos llevamos? We've been like 2.5 minutes.
¿Cuánto llevamos?
2 minutos y medio.
¿Solo?
Sí, parece más. So sometimes it's more what they tell us. Obviously, when they are very tanned, it's harder to see the redness. So it's more like what she explains, what she feels. So now she was saying that the burning sensation is like 7 out of 10 or something like that.
Baunya apa ya, Mbak?
Baunya apa?
But we don't see a lot of redness. It's,
Ya asam salisilatnya.
Si quieres que te lo quiten un ojo, me levantas la mano, me lo dices, que estamos aquí mirando la piel.
Ini bisa untuk bibir dong.
Este te lo habíamos dicho ya.
No.
O sea, es normal que pique, tiene que picar.
Netral.
Sí, I already put the neutralizing spray here because I always have it ready. And so if she tells me, no, this is too much, I will neutralize. Yeah. So normally I just do a lot of, and that's it.
Boros ini, Mbak.
Udah disemprot
Itu dok, biasanya ditap 3 kali aja.
We have
jangan
to know that
banyak-banyak.
when we neutralize, it's going to be very itchy because we are changing the pH very quickly, and this is a solution of water and bicarbonate.
Suruh ngirim Pak
So
Niko
it's a
daftar
very alkaline solution. So the pH is going to go up very quick, and so she will feel a lot of burning very quickly, okay? So this is one of the things that we need to have in mind. Okay. Mejor? Lo quito ya. I can already see that she's already quite red in this area around here. Okay. Yeah. Sometimes because of the glycolic acid, if you have sensitive dry skin, you could even find a little bit of frosting in certain areas, okay? It's not common, but in very dry skins, you can see this because of glycolic acid. It penetrates quickly, and it's the frosting because it's deeper than we would like to. Normally because of the condition of the skin. Okay, we can leave this. ¿Mejor ahora? ¿O pica más?
Cuando me aprietas me pica más.
Tapi itu kan murah tuh, Mbak.
Sí, la crema la pondré luego porque como
Tapi itu
ella
packagingnya kan dapat
Dapat.
primero
neutralizernya.
empezamos así.
Biasanya kita di sini terus baru
Me descuesta un poco como al final de los ojos. ¿sabes?
Sí, aquí,
Sí, ahí.
Langsung merah.
Sí, el intenso empezaremos por ahí.
Kelopak matanya nggak di netral ya?
Super ice.
¿Mejor ya?
Sí.
Okay, so now the burning sensation is gone back down, and we are going to start working with someone with very thin skin. Okay, so now we are going to go with intense. Okay, if you want. Perdona, tu nombre. Laura. Mira, siéntate si puedes. Mira, ponte un pelín para atrás. Vale, déjame que suba un poquito esto. Aquí, creo que vamos a subir más. Y si quieres, eso es, porque para rellenar, vale.
No, langsung kenceng lah. Tight.
Yeah.
Already tight.
Sí,
Yes, already
Es
tight.
ahí donde más cocía más.
sí, está un pelín rojo. No te ha entrado en el ojo ni nada, es de aquí, por eso te lo he neutralizado antes de los 5 minutos. Okay, so in her case, what I was saying is that she already had filler last year, so of course placing in the tear trough it would not be necessary. This one it's already done. This one maybe we could place a little bit more, but as I said, depends. And what we're going to try to do is to achieve a little bit of this lifting effect to improve the pre-jaw area and the jaws here, okay? This is very normal in thicker skin. So what we are going to do is to place our filler first around the zygoma arc, and then we will place a little bit of filler here around the pre-auricular area to get this tighten effect without adding too much volume in the midface, because if we add a lot of volume in the midface, in her case, she's going to feel more heaviness, okay? Entonces, te lo explico en castellano. Lo que vamos a hacer es poner relleno aquí, no mucho, para darte un poquito más de este tirantez, y rellenar un poco la parte de aquí para intentar mejorar esta zonita de aquí, ¿vale? Que no es que te descuelgue mucho, pero sí que es verdad que como tienes la cara redondita, aquí es a veces en el jaw donde se acumula un poquito más de grasa, aquí.
Pero no me veré muy hinchada.
No, por eso te digo, lo vamos a poner aquí detrás, no lo vamos a poner delante que no caiga. ¿Sabes? Como quitarle peso de delante y estilizar un poquito el óvalo facial, ¿vale? Sí. Ahora aquí.
¿Vas a empezar con cánula o con aguja?
No, pondré con la aguja y haremos como los puntos.
25 itu sama dengan volume.
With the technique, we always start here at the zygoma arc. Un pinchacito. And we place around 2. The vials are charged with a little bit more than 1.
Iya. Udah, dapat.
It's intense. Okay?
Tebal banget nggak tuh ya?
We go up around the zygoma arc. And we place another 0.2. Bien?
Que se apoyan en la camilla.
Sí. Es que ahora estábamos haciendo formaciones con una cámara. We were starting to do these trainings with a camera because it was easier, but now today was difficult to do this. So Okay, we can already see there is a little bit more of this effect here, and we'll do another third point in the zygoma arc around this 0.15. Okay. Si quieres apretar aquí.
¿Yo?
No, ya está. Tú así. Si te duele, si lo que sea, nos avisas.
Vale.
Okay. Maybe now we can see a little bit of a difference from one side to the other. If we do like this, we have a little bit more of projection in the lateral zygoma without having a lot of how do you say, a lot of volume, because she says she's worried she does not want to look with a lot of volume, so this is also important.
Si quieres apoyar en mi mano, te aguanto la cabeza. ¿eh?
Yes. I have Dr. Andrea also with me today. She's an endocrinologist, very famous for menopause treatment, so very happy to have her here today with me. I do the same here. I start here, place 0.2. Here I place another 0.2. And here I apply 0.15. Straight in the zygoma arc, so just straight on top of the bone to achieve a little bit of that lifting effect. We are going to get another syringe of intense
For this here and the
Here.
This one I have a third because I'm not sure now.
here and
I brought not so much.
Yes,
because
yes.
it's so much.
Yes, I think it's better one more shoot in here.
With
Yes,
cannula now.
because this is not this.
Yes.
If you would like more, you
Yeah.
can make here with cannula
Oh, okay.
and this.
Or
Here.
oh, okay. Oh,
Okay,
okay.
you put them just put them here.
Oh, okay.
Yeah.
So from here,
So
like
this is a 22 gauge cannula, and normally whenever we are going to start to do the treatment here, I prefer to do with a 22 gauge cannula. So
Puedes apoyarte,
maybe,
yo te aguanto.
okay, careful because I'm going to do a little puncture, un pinchacito. It's lifting a little bit more because she has very, very thick skin. This I will go more superficial. Careful with. Okay, with the other 0.5, I go right here. Okay, very superficial, and I go, sorry, straight to the piriform space. Normally with a 22 gauge needle cannula, it's safer in terms of it's very hard to get a cannula here. I always kind of wait here and then start to do a little bit of retro injection. Molesta un poco, ¿no?
Esta zona molesta un poquito.
Sometimes we need to, okay, do like retro ultrasounds this way. So instead of directly feeling, I'm doing this fanning technique to actually extend like this, okay? You can perfectly see the point of my cannula from here to here. And that would be, for instance, my take with her to improve this nasolabial fold without applying too much product and making her look heavy in the central part of her face, for instance. I think if you can notice, we started up here, we went to the middle, to the back in her case. A lot of people we need to give a little bit support in the soup, and then we go here to the nasolabial fold. And I think you can see already, okay, a nice change, a very subtle change without making her look too heavy in the middle part, which is something that I see a lot, and it's caused by fillers sometimes because we put too much quantity here and then it tends to get up here and it falls. In her case, this is what we're doing and it looks very nice. One of the tricks that I wanted to show you, because I told you about doing the SUF area, but in her case, we don't need any extra SUF area, okay? We can place our cannula We can go 1 crick or 2 crick, okay? Now I go 2. If I do like so, I cannot really lift the skin, okay? You can see the point of my cannula. So from here, if I wanted to do the teardrop, this would be my plane. So here, I am safer, you know, I am deep. If I want to go more superficial, for instance, with a skin booster, sometimes I put skin booster with cannula. I go only 1 click and you can feel the needle. You see the difference? So this is because you're more in the superficial fat pad, and this would be great. And if I do like this with my needle, I see the entire point of my needle. She has thick skin, so obviously with her it's not so easy to see as with other patients, but this is important because if I want to do a skin booster, I'm always going to place it here. If I go deeper, it will be great for her adipose tissue, but not for the skin so much. Okay, so in her case, we don't need to do that now because she has really thick skin, but in some patients it can come in handy if we're not sure of the plane we have with them. ¿Estás bien? ¿Te mareas? You can really see the change, okay, around here and here, although this nasolabial fold, it's not so deep as the other one. ¿De qué lado duermes? ¿De este?
De este.
She sleeps in this side, so this is why this side is a little more, it's a little worse. Not. Siempre tenemos un poquito peor el lado en el que dormimos, ¿sabes? This is the same. We put our guide needle here. We do a little bit of pressure. There's a little bit of bleeding always, which is normal. Okay. And we take our needle, we go straight back, okay? She has very thick skin, so sometimes I have to do a little bit more pressure, and I do as before. I do retrotrasants, I massage. Normally I always try to do it with my non-dominant hand. I massage with my left hand because the right hand for me is easier to control the syringe, but and you do small fanning technique, small lines of 0-1, and you massage, you press down because you don't want to add volume to this to the lateral zygoma, okay? To lateral zygoma, sorry, to these preauricular areas, just to reinforce this space. We already reinforced the zygoma with the supraperiosteal injections, okay? So this is the same, you massage, you press down because you don't want to give volume, and you can already see this has improved a little bit. In patients with very thin skin, you see this straight away, but it's going to work great. And I'm going to do the same for this area for her to try to improve a little bit of this.
Bleeding at all.
No, not a lot of bleeding. So I do the same. Okay, I do a little injection here. Here I don't need to go so deep. Sometimes you don't even see the bleeding. And I go with my cannula. Very superficial, you can see, as I said. You can even see the tiny lines because this is the skin I'm actually affecting. Okay, and I go right in the piriform space. I touch the point of my cannula. I leave there retrotrasants in this pattern. Okay, I don't want to give her a lot of like a line here because that would not look very nice, and so I do like this. Like this. See?
Ya, terkoreksi langsung.
Sometimes when we do filler, you see now, you cannot really see. This will improve obviously in 2, 3, 4 weeks because there is an improvement of the condition of the skin, and you are going to find there is a bigger improvement in the overall treatment after 2 weeks of doing this treatment. Okay, so I'm going to prepare that and I'm going to show you.